My soul is cast down within me. Therefore, I remember you from the land of Jordan and of Hermon, from Mount Mizar. Deep calls to deep at the thunder of your cataracts. All your waves and your billows have gone over me. I think my earliest memory of being anxious was when I was 7 years old. I grew up in an immigrant family. I'm an immigrant myself, and so my parents worked very long hours, worked very hard, and we were latchkey kids. I was essentially left by myself after school and waited until my parents came home. I think that was when I first started experiencing this anxiety that my parents could perish in a car accident on the commute home and I would be left an orphan. To cope with that, I developed this regular practice where I would call up my mom's office knowing that she'd already left from work. A coworker would answer and say, "No, Joanna Chang's left for work." And I would say, "Oh, okay. Do you know what time she left?" And this was back in the day when they would actually punch out on a time clock. And so she would go and check out on a time clock and say, "Joanna Chang left at 5:05 or 5:10. I would then calculate what 60 minutes from that time would be like, and that would be where I would peg my expected arrival time. If they arrived later than 6:10 or whatever that time was, that was where my anxiety would start rising by the minute. That was not recognized as anxiety. I don't ever remember anyone bringing up or myself acknowledging or labeling this as anxiety. It was simply put names like, he's really intense, he's feeling a little stress, or he's a thinker. I was always more put in the form of, I think intensity was a common way that was described. And then I think internally, I was rewarded for acting anxiously, frankly, right? I mean, because my anxiety was so functional, it actually resulted in behavior that produced good results in the world. There wasn't a lot of incentive to actually stop doing that. Culturally, there just wasn't very much of a category for anxiety in the Asian American experience in the 1970s and 1980s. There was, in my childhood, in my immigrant culture, certainly a kind of a stigma attached with anxiety, and certainly labeling it as a mental health issue was something that just never came up in that category.
Stress and anxiety can be functional, but when it gets to the point where it's debilitating, we probably need to seek some professional help. Stress and anxiety can lead to panic attacks, kind of the stress coming to a point where the body is having an extreme physiological response. It's heart palpitations, it's sweating, it's feeling like you can't breathe. I think one way to put into perspective and looking at anxiety and stress and how it affects us and how it becomes more severe is to imagine you have a jar, and in the jar contains your basic genetics. And then you have historical experiences, any kind of maybe stress and trauma that might have accumulated during childhood, early adolescence. And then into that jar, you add all the stressors of now our daily lives, what's going on in the world, relationship breakdowns, or other kinds of things that are then affecting us, and all putting it kind of into this jar to the point where you can't handle it anymore because of the various additions of things. So all those, acute stressors put into the jar, now it just overflows.
It seems that in our culture, we have fragmented out mental health from other kinds of whole person health. And yet, if Christians can experience other kinds of health issues, cardiac issues, digestive issues, then they can also experience mental health issues. But it really gets at this story that we have that somehow if we have a mental health issue, that there is a moral failure at play, that a person doesn't have enough faith, or that they're not loved by God, or somehow that they're not inside the will of God. But we don't see any other health issue that specific way. My hope is that we can see health issues on a continuum that includes our mental health and our well-being, and that allows for us to see as Christians that as whole people, our suffering actually deserves the care and attention of the church, including when it exists in the psychological or mental realm.
My senior year of college, I had some severe back pain that I started struggling with, and actually had to drop out of school with 1 semester left to graduate. Went home, wasn't sure I would be able to even return back to college and finish my degree, and all of my plans fell apart. The chronic back pain was one in which I would try everything and nothing would work. So it was a breakdown because all of my coping mechanisms, my functional anxiety, was not landing on an answer. So I started to struggle with more and more insomnia. I remember having my first panic attack, just this rapid heartbeat, sense of the world kind of closing in on me, feeling like completely out of control. It was just an awful, horrible, horrible experience. For me, it took a breakdown to actually realize that my existing pattern of functional anxiety could not take me any further.
Mental illness, generally speaking, if we're thinking clinically, is when the symptoms become unmanageable to the extent that they interfere with one's daily functioning, school, work, relationships. And at that point, that really tells us that this person needs some intensive care of one kind or another. In terms of diagnosis, we usually go from severe, moderate to mild. And at the severe end, there's always a cluster of symptoms that always are present. Things like psychosis, suicidality, failure to thrive, or just being flat on your back in your bed and just cannot get out, don't want to talk, that kind of thing. Those are all indicators of severe mental illness.
After college, I felt called into a career in ministry. Eventually, I became a pastor of a church. I took over as the lead pastor from the founding pastor. I didn't quite recognize how stressful that was. Then we had a dot-com crash, which caused a loss of membership, a loss of revenue. I had to do layoffs. It was just getting to be too much. And the first warning signs was, for me, as is often the case, was insomnia. I was having a harder time sleeping. A sense of joylessness started to creep into my sense of work because of my own perception of what a senior pastor of a church had to be like. I kept so much of that inside, unrecognized myself and unrecognized by other people. The pain with the isolation is what especially made it worse. It was a self-imposed isolation. And so it wasn't until I had that breakdown and where I could no longer function and went into disability that it was revealed to me of just how capable the church was to actually extend that grace to me. And they were incredibly generous in giving me leave. Never really got the sense that I had let anybody down. Received a tremendous amount of room, brought meals and expressed care, but they were also very respectful into not prying or demanding an answer. I made it through to a sabbatical, and then once the sabbatical started, I just stopped sleeping, like completely, for about 2.5 weeks, and just spun into really a dark place with multiple panic attacks, sometimes multiple panic attacks a day. And that sent me into a 6-month disability where I was barely functioning, I think, at that came. And so that was a major crisis where I thought I was done. It sent me into a pretty dark night of the soul where I felt very distant from God and where God just felt completely absent.
We're not just spiritual beings, but we're also embodied beings. One of the great things about the biopsychosocial spiritual model is that each one of those is reliant on the other to exist. Some things go wrong biologically. And so, of course, Christians can have mental health problems because we live in a world where there's suffering. These are things that even Jesus himself was not isolated from when he lived here in his bodily form. And so we can expect the same.
In order to give someone a diagnosis, we're using a series of assessment measures, tools, diagnostic criteria, observation, patient interviews, and symptom reporting that help us get a sense of how much a person is in distress, how long the distress has been going on for, how it's impacting them and their quality of life and their functioning, and if it meets some of the diagnostic criteria set out for us by the Diagnostic Statistical Manual that helps us know that they're within a certain category or framework of mental health issues.
The pain and suffering was so great that I went to go get mental health counseling, saw a psychiatrist, got the diagnosis of anxiety and depression, started taking medication for it, and all of that helped. Secular mental health was critical. Psychotropic drugs, the medication that commonly used to treat anxiety, depression, was helpful in getting me out of the dark depths of it. I absolutely think that there is value in there, that God created the realm of psychiatry, that God is behind and can be found in science and in medication. At the same time, there's also limitations to that realm as well. They will be able to treat the symptoms. Well, they often will not be able to get at certain questions and meanings and longings that were behind my depression, that were existential in nature, where it was about calling and purpose. It was certainly multiple years of this dark night of the soul, which lasted beyond the actual depression. So the depression probably was about 6 to 9 months. And then I started recovering in terms of the actual emotional experience of depression, but spiritually, the recovery took much longer. The dark night of the soul that I experienced is what a lot of the Christian tradition describes as when, on the human side of the God-human relationship, things just go dark and you just feel like God is not present. Prayer feels like a meaningless exercise. I gave myself permission to experience all those feelings. I deep down think was anchored on a conviction. Look, if the center of the Christian narrative is the cross, the cross is the moment when the Son experienced the sense of bereftness from the Father, and yet somehow Jesus clung onto the sense that God, the Father, was holding him, even if he was subjectively experiencing abandonment. And so that core spiritual insight was the anchor for me. I was hanging on to this truth that the Christian life is not fundamentally anchored on our subjective experiences. It includes our subjective experiences, it embraces our subjective experiences, but what we feel at any given moment is not necessarily objective reality. That actually ended up launching me into a much deeper practice of contemplative prayer. The anchor of contemplative experience is the truth that there is a God present who actually transcends your subjective experience at the moment. My dark night of the soul set me up for a ongoing practice of that particular spiritual practice.
I'm often asked this question about the extent to which Christians should or shouldn't embrace what might be seen as traditional models of care, like taking medication or having therapy. And I think the important thing to say is that despite the fact that I'm a psychiatrist, I wouldn't inevitably seek to medicate someone. Our first role as mental health professionals is to understand what's going on. So we take a detailed history, and then thinking about whatever difficulty they're experiencing in the moment that's brought them to my attention. There are a number of instances where I will diagnose someone with a mental health condition and not feel that it's appropriate to give them medication. As psychiatrists, we like to think as broadly as we possibly can, and it is about utilizing the resources that that person has available to them. And that, for me, is why it's really crucial that the church can be equipped where appropriate, to support people.
Often what happens with individuals, especially with anxiety and depression, is they become so fatigued, if you will, emotionally, physically, spiritually, that the ability for the body, even with counseling, prayer, other things, just do not have the resources to bounce back. And medication, appropriately used, can be very helpful. We also know that there are some disorders like bipolar disorder that has clear, brain neurochemical changes that medication can make a dramatic difference. I see it as a gift from God, and you can list all the times it's inappropriate and why not to use it. But that doesn't take away from the good gift that it can be, and not much different than insulin for diabetic, glasses for those of us who have difficulty seeing.
The power and value of a medical diagnosis gives cultural authority to medical diagnosis, and it normalizes it. It's like once you say, I've been medically diagnosed for anxiety, depression, it actually becomes freeing in the sense of it's easier to talk about, it's easier to share about, because you've sort of got the cultural weight of medicine, you know, sort of behind it. So I think that's enormously valuable. And it also gives you access to particular medications that may be particularly helpful. I think there's a dimension of it, though, at a more personal, emotional level of actually accepting it, receiving it, internalizing it, and almost coming to terms with it in a way that is complex, right? Because at one level, you have to actually come to terms with it and accept, like, okay, I am somebody who is anxious. I struggle with anxiety. I am experiencing depression. And then there's the sense of this also doesn't define me necessarily, because I think that can also go in the other direction, like I will always be this way, or I am that person. I think I've had to go through all of those stages of, at one level, embracing it, recognizing this is true, but the other hand saying, and yet I'm more than that. This diagnosis describes who I am now. It may not describe who I am 5 years from now, 10 years from now. We receive labels that are actually helpful and important to receive, and also at times we need to say, I'm more than that label as well.
If you get influenza, nobody calls you the flu. But if you have schizophrenia, people start to use language like, you're a schizophrenic, or you're a depressive, or whatever it is. And as soon as you do that, the person is taken out of it, and you just simply become a name, and a diagnosis, and a way in which people can name you and label you. So it's different. So physical illness, if you get cancer, that doesn't happen for the most part. But if you have a mental health challenge, it does happen. It's just that people have a different perspective that they place on difficult situations.
I realized that my own sense of calling as a pastor was outdated, frankly, and that God was calling me to something new, in particular a career in the social sector space from a secular perspective. I really am grateful for that crisis and for the dark night of the soul, and I view it as part of God gently and sometimes forcefully, you know, pushing me into a new career. I would still call myself as somebody who is very prone to anxiety. I'm much more aware of it now, and I catch it earlier, and I have much more set of practices that I can go to when I do catch it. But it's certainly an ongoing journey, and I think if I have one message on anxiety and depression for Christians, it's that there is a deeper third way than the two primary options that are so often offered to us as a response. So I would say one of those options is the anxiety is a sin. It's a character flaw. So we're supposed to pray it away, have God just sort of somehow whisk it away if we pray hard enough. The other model is just to simply say then, well, it's just solely a mental health condition for secular mental health to treat alone, for us to get therapy and to take medication, all of which has value and should be done, but to simply reduce anxiety and depression to simply that realm of a secular mental health condition that our faith has nothing to speak to is also going the other extreme. And so what I really want to invite Christians is to think about something like anxiety as really an opportunity for spiritual growth. That there's a way to go through anxiety in a way that allows God to actually take us deeper, not to make it go away, but it actually is a door for us to go through, for God to do a deeper work of formation in us. My soul is cast down within me. Therefore, I remember you from the land of Jordan and of Hermon, from Mount Mizar. Deep calls to deep at the thunder of your cataracts. All your waves and your billows have gone over me.